Hi, my name is Emanuel Cruz Carrasco. I'm going to read Chapter 3 of the textbook Professional English Use in Medicine. Chapter 3 Parts of the Body 2. A. The abdomen. The main organs of the body have ordinary English names, and doctors use these words. But when an adjective is needed, they often use an anatomical word. For example, we can say disease of the liver or hepatic disease. Some abdominal organs, for example, the pancreas, have no ordinary name. Here we have a picture of some abdominal organs. The pancreas, the duodenum, the gallbladder, that is different from the regular bladder, the liver, the right kidney, the stomach, the spleen, and the left kidney. When doctors talk about the main parts of the digestive system, they use the words bowel or intestine, the small intestine or the small bowel, and the large intestine or the large bowel. When speaking to patients, doctors may refer to the anus and rectum as the back passage and the back passage. The back page. B. The chest. The chest, thorax, contains the organs of respiration and the heart. The main parts of the respiratory system are the airways and the lungs. The left lung is divided into 2 lobes, and the right into 3. The airways consist of the larynx, the trachea or windpipe, the right and left bronchus, and the bronchioles. The chest is separated from the abdomen by the diaphragm. C. The pelvis. A doctor is explaining the functions of the bladder to a patient. The bladder is situated in the pelvis. As you know, and it is connected to each kidney by a long tube called the ureter, one on each side. The ureters carry the urine from the kidneys to the bladder, where it is stored until you decide to empty your bladder. When that happens, the urine passes down another tube called the urethra to the outside. Now I'm going to read the exercises of Chapter 3 of Professional English Use in Medicine, Body Parts, Part 2. Exercise 3.1. Label the diagram using words from the box. Look at the opposite to help you. The words are diaphragm, lungs, windpipe, heart, lung, airways, bronchioles. The first one is the airways. The second one are the lung. The third, the lungs. Here is I think this is the left lung, so it has 3 lobes. Then we have the diaphragm that separates our thorax and abdomen. We have our windpipe, our heart, and the bronchioles. Exercise 3.2. Match the conditions 1 through 8 with the organs affected 1 through H. 8 through H. Using your medical knowledge. 1. Hepatitis. E. Liver. 2. Pneumonia. F. Lung. 3. Nephritis. D. Kidney. 4. Gastric ulcer. G. Stomach. 5. Cystitis. A. Bladder. 6. Angina pectoris. C. Heart. 7. Cholecystitis, that is different from the cystitis that is associated with the bladder. 7. Cholecystitis. B. Gallbladder. A. Ulcerative colitis. H. Large bowel. That is also called the large intestine. 3.3. Complete the textbook extract. Look at A and C opposite to help you. Examination of the abdomen. To examine the patient for large abdominal organs, first feel for the liver and the kidney on the right side. To do this, ask the patient to take a deep breath while pressing the fingers upwards and inwards. Next, feel for the right kidney and then cross over to the other side for the left kidney. Still on the left side, palpate for an enlarged spleen. Finally, moving to the lower abdomen, feel for the bladder, which is only felt if it is full. Usually, in the optimal medical condition, or healthy, is full of urine, possibly clear or yellowish. Well, that was chapter 3 of the textbook Professional English Using Medicine. Well, thank you very much for watching this video.